Here to help us break down the very latest on the coronavirus and the Omicron variant is Dr. Jeff Pothoff from UW Health. And Doctor, thanks for being here with us this afternoon. I want to ask you about that new quarantine recommendation and why the decision to shorten it now, more than a year and a half into the pandemic.
I think there's a couple of factors. I think one, we've learned a little bit more about when virus concentrations are the highest in those who are affected by COVID-19. And it turns out your highest concentration of virus is 2 days before you have symptoms to 3 days after you develop symptoms. So, from a purely technical standpoint, there will be some folks who at day 5 may not be shedding virus and could go back to normal. I think what's difficult about this guidance is there will be plenty of people who are still shedding at day 5, especially if they really have any symptoms at all. So the difficulty in this one is the nuance in making sure that people apply the 5 days to them versus, say, others who may need to wait a little bit longer before they get back out in public.
And Doctor, we are seeing these long lines for testing in many places across the country, but definitely here in Milwaukee. When should people be tested? Is this just after a possible exposure, or should it be when they start feeling symptoms?
Yeah, I think, if you're involved in some sort of activity that's high risk, so you're with a large group, say indoors, unmasked, and you're worried that you may have been exposed, you want to give that virus time to replicate, or you could get a false negative test. So we typically recommend 3 to 4 days after that exposure, go ahead and get tested. Certainly, if before that you develop symptoms, as soon as you develop symptoms, that would be a good time to get tested too.
And we are hearing reports that the Omicron variant is less severe but more contagious than other variants. Does that echo what you're seeing in hospitals right now?
I do think that's what we're seeing. It seems to be that Omicron is much more contagious, so many more people will likely be infected. On the positive side, it seems like it does cause less severe disease. Now, not that it can't cause severe disease, just less, a lower rate than with Delta. What we worry about, though, is if so many more people get infected, even if it causes less severe disease in most of them, it could still cause enough severe disease where we see a run on hospitals.
Okay, Dr. Jeff Pothoff from UW Health, thank you so much for your time and your insight this afternoon.
Thank you.